Good day everyone. Today we will present about the HIV or AIDS cases here in the Philippines. My name is Krishna and I will serve as your host about HIV or AIDS. Is one of the fastest growing epidemics in the Asia Pacific and it affects thousands of Filipinos, especially the youths. So our presentation will cover the background, the problems, and also the impact of citizens, and the economy and the possible solutions. We chose this topic because awareness is the first step forward prevention and the compassion, and we believe that education can save lives.
Hello, my name is John Marcigobre. So I will discuss the rationale and background of HIV/AIDS in the Philippines. So HIV/AIDS or human immunodeficiency virus attacks the immune system, specifically CD4 cells, and if untreated, it can progress to the AIDS acquired to immunodeficiency syndrome. So in early 2025 alone, more than 5,000 new cases were reported, which is a 57% increase compared to the last year. Most cases are among people aged 15 to 34 and 96% are due to sexual transmission. Showing how vulnerable our youth are. This background explains why HIV/AIDS is considered a national public health emergency by Department of Health and why urgent action is needed.
Issue and problem. Good day, I am Lyle Antonelacha and I will talk about the issues and problems related to HIV and AIDS in the Philippines. One major issue is stigma and discrimination, which prevent many Filipinos from getting tested because of fear of judgment. Another problem is delayed diagnosis, with a 12% increase in advanced HIV cases reported in 2025. Meaning many patients only discover their status when the disease is already severe. Access to treatment is also limited, with only about 66% of diagnosed individuals receiving therapy. Far below international targets, misinformation also spreads in communities, with some people still believing HIV can be transmitted through casual contact, which worsens stigma and isolation. Example for this is some patients lost jobs or face rejection from neighbors after their HIV status is revealed. In rural areas, many must travel far to reach clinics, making treatment harder to access.
Example, some patients lost jobs or face rejection from neighbors after their HIV status is revealed. In rural areas, many must travel far to reach clinic, making treatment harder to access.
Impact of citizens. Hi, I am Chona Formentera from Bshm 3C. My part will focus on the impact of HIV/AIDS of citizens. The health impact is severe as HIV weakens the immune system and makes people vulnerable to opportunistic infection like tuberculosis and pneumonia. Patients often struggle with fatigue, frequent hospital visits, and emotional stress, which affect their ability to study, work, and live normally. Family also face emotional strain as caring for someone with HIV requires long-term support and financial resources. These show that HIV/AIDS is not only a medical issue but a social challenge that affects the daily lives of the Filipino. Example, HIV patients often suffer repeated hospitalization due to infection like tuberculosis. Families sometimes sell property or borrow money just to cover the medical expenses.
Impact of economy. Hello, my name is Kimberly Antalinteng from Bshm department and I will discuss the economy impact of HIV/AIDS in the Philippines. Lifelong antiretroviral therapy is expensive and the government must allocate significant funds to provide treatment. Families also face financial strain as they need to support loved ones with medical care and daily needs. Productivity is lost when young workers are affected, weakening the country's workforce and reducing economic growth. Stigma and employment also discourage HIV positive individuals from seeking jobs or opportunities, which further limits and their contribution in the economy. The rising number of cases place a heavy burden on the healthcare system as the nation develops.
Example, the government spends millions each year to provide free HIV medicine. Young workers such as call center employees may miss work, often lowering productivity and income.
Possible solutions. Good day, I am Rika and I will present possible solution to address HIV or AIDS in the Philippines. First, we need stronger education and awareness campaigns, especially in schools, to promote safe practices and fight misinformation. Second, testing and treatment must be more accessible with free HIV testing centers expanded nationwide and medicines made available to all. Third, government and community. Leaders should work together to fight stigma and normalize HIV discussions so people feel safe to get tested. Finally, youth involvement is key, as per education and support groups can help spread accurate information and encourage responsible behavior. Solutions must combine education, healthcare, and compassion to be effective. Thank you.
For example, peer-led seminars in school can spread awareness about safe practice. Mobile vans can bring testing to rural areas, while barangay health workers can correct myths in community.
HIV cases among young Filipinos are rising at an alarming rate. On World AIDS Day, it's important to know your status. You can get tested at government-run social hygiene clinics, which offer free testing and care. Many non-government organizations also provide free HIV testing, counseling, and treatment. Some government hospitals and healthcare facilities offer confidential HIV testing. Certain private healthcare facilities and hospitals also offer HIV testing. Remember, knowing your HIV status is the first step to protection and care. Don't wait, get tested today.
Hello everyone, my name is Bagyo Mark J and I will conclude our presentation, which is the HIV or AIDS is not just a health issue, it is also a social and economic challenge that affects entire nation. With awareness, compassion, and action, we can fight this epidemic together. We encourage everyone to get tested, support those living with HIV, and help spread accurate information to reduce stigma. Together, we can build healthier Philippines where no one leaves behind. Thank you for listening to our presentation and mayong hapon kanyang tanan.